You're listening to Astonishing Healthcare, the podcast hosted by Judy Health, focusing on the biggest issues affecting healthcare consumers, benefits plan sponsors, and health plans. We're covering how things truly work or don't in the U.S. healthcare system and pharmaceutical supply chain, and we're doing it in an astonishingly efficient way.
Hello, and thank you for listening to another episode of the Astonishing Healthcare Podcast. This is Justin Veneri, your host and Senior Director of Communications here at Judy Health. And for this episode, we've got two members of our product team in the studio with me, Liya who is a Senior Director, and Jake Mulkey, a Director. And they've both been heavily involved in the development of our unified claims processing capabilities and the development of Judy Health. Liya joined us for episode 58 earlier this year, which was such a fun discussion about actually building Judy Health. And Jake was on for episode 39, which we mentioned recently with his counterpart for that episode, Samantha Custer. And that was on how he worked closely with the comms team to ensure that we could provide a compliant transition benefit solution. Thank you both for joining me today.
Thanks for having us.
Good to be here, Justin.
All right, quickly. I know we have a lot to get through here in a short amount of time, and you guys are buried. So, Liya, can you go first? Share a little bit about your background, path to CapRx, and now Judy Health.
Yeah, thanks, Justin. So prior to Judy Health, I worked at a handful of different healthcare systems in New York, primarily doing some data analysis and figuring out how we can make healthcare delivery a little more efficient. And since joining CapRx, I've worked on our operations teams and then moved over to product to help support the build of pharmacy claim adjudication and now unified claims processing.
Got it. Jake, same to you, please.
Yeah, for sure. I've been at CapRx about 4 years. Prior to CapRx, I was working for a few years in the prior authorization space and specialty drug hub programs. Since joining CapRx, Judy Health, I've been kind of on two main areas of focus: data exchange, claims accumulations and eligibility exchanges, and the vendors associated with those. But then the last few years have really moved more overseeing our pharmacy adjudication product teams for all of our lines of business.
Awesome. Well, I love working with both of you guys and seeing all the product updates and everything else that comes out of your quote unquote shop and building medical. That's what the discussion is about today. After building out a new pharmacy benefit administration platform several years ago now, I can't believe how fast time flies. And I think, well, I'm pretty sure all the survey data out there show this. Everybody out there, plan sponsors, health plans, you name it, they want better care for their members, lower costs, and improved transparency. So how has our experience in pharmacy claim adjudication and administration helped us or helped you to tackle building out medical? And does that extend into dental and vision?
Yeah, so there's this joke in health tech that I think about often, right? Where everybody who joins healthcare trying to figure out how we can fix, healthcare in America, their first thought is, hey, all I need to do is build my own electronic medical record, and that'll fix everything. And as a result, the healthcare landscape is full of people who tried to tackle that, learned a bunch of lessons the hard way, and kind of pivoted away. And the same thing is pretty much true on the administration side. So we've heard AJ talk a lot about how there's this huge misalignment between the sort of investment and focus that's been put into tackling the care delivery, so tackling the electronic medical record side of things, but really not as much on the administration side with claims processing, eligibility accumulators, everything else.
Yeah, it was just a bunch of Band-Aids and acquisitions and roll-ups, and you have all these different systems that don't talk to each other as a result, right?
Exactly. But people are trying to solve our side of it too, of course. So when we set out to say, we're going to build the first unified claims processing system this country has seen, there was a lot of very rational skepticism because lots of folks have tried building their own claims processing platforms, and it took them a lot of years and a lot of investment, and sometimes it didn't work at all. But we were able to make it happen in 1 year. And I think it's precisely because of our background in pharmacy benefits and everything we learned along the way building out Judy to process pharmacy claims.
And Jake, you have, as you were describing with your background, an interesting mix of experience in product development along these lines. How did building out the pharmacy claims processing platform really help in terms of preparing us to execute on building out medical claim adjudication alongside of it?
Yeah, so I think there's this kind of large and potentially incorrect perception that pharmacies are a really easy thing, or it's the easy side of the business to get correct or to scale because it does touch so many members, touches so much of our clients, and directly impacts behavior at point of sale. But pharmacy is hard. It is not an easy kind of shoe-in thing to do. And I think because it is so often behind the scenes and it's not something that is necessarily the flashiest of all of our products or all the things that Judy Health has to offer, we have a lot of very creative plan designs, a lot of high level of configurability within our tool tool, and we've built the tool in a way that allows Judy to handle those very unique situations at scale. And doing that has really made it a lot easier for us to transition into medical, right? There's a lot of this pressure in pharmacy to get things right from a claim adjudication standpoint, obviously in real time with members at point of sale. And because we've had to work in that environment, thinking ahead of go live dates for clients or partners that we have, where pharmacy has to be basically perfect and spot on day one, we've worked in an environment where those configurations have to be readily intelligible, not only to the users, but to clients themselves. And then obviously that flows down to members' experiences in filling claims. And so just one example really of how built Judy and kind of are using the tools that we have to not start from scratch and reinvent the wheel when we move into medical claims processing.
And I'll give you an example because we have this New Year's Eve tradition on the pharmacy benefit side of the world where, since the launch of Judy in 2021, we stay up until midnight on December 31st, and midnight precisely on the dot, the new pharmacy claims start rolling in. And we like to, bet on what the first drug is going to be and what state is it going to come from and things like that. And let me tell you, it was such a hard left turn launching medical claim processing this year because we did not get a single claim until I want to say January 8th. So you can imagine with my background in pharmacy, I was losing it every single day. That first week of January, where are these claims? Where are they? Why aren't they here?
Is this working?
What's happening? Is this on? Is this machine on?
Yeah.
And it was on. It's just that, again, medical is not set up to live in this real-time world.
I remember you saying you wanted to be the first claim, right?
Exactly. So we launched this for Capital RX, now Judy Health employees, January 1st. And I really, really wanted to be claim number one in the door. I got my appointment with my doctor, so I got the earliest slot on January 2nd. I showed up, and then my claim didn't actually arrive until 3 weeks later. So somebody else got, the coveted claim number one slot, and mine was like 400 something, I want to say. And that part of it is just, whatever. Who cares if you're claim number one or claim number 1,000? That's not the important part. The important part is that I had to wait for 3 weeks to figure out how much I owe for that encounter that I already had. My doctor had to wait for 3 weeks to see if the care they provided would get covered. And that delay is something, again, that we're so not used to in pharmacy because we're used to making these decisions immediately and everyone at the point of sale having that clarity all at once.
So where do we go from here?
Yeah, great question. Where do we go from here?
I was just going to say, I think one thing that's kind of to retouch on or maybe just elaborate on some of the points Liya's made. With pharmacy claims being real time, there is that human standing at point of sale. And because of that, and I'd mentioned this too, right? We have to focus so much on making sure things are accurate. And I think the interesting thing, and Liya can obviously speak to this more, but in shifting to medical, because we have more time to ensure accuracy, we also probably have more time to think through, well, what are the things that we want to do differently that maybe aren't standard on a medical claim processing, right? So not only is it accurate and is it timely, but are there changes to the ways, just net new changes in the industry with how medical claims benefits are figured, are set up, how we interact with networks, how we interact with payments. And it really allows Judy to figure out and chart the course that we want to take in that kind of less of a pressure cooker environment and really start from square one. I don't know if that's something, Liya, that resonates with you, but I can imagine if I'm building off of building blocks that I've already had from pharmacy benefits and the lessons that I've learned from that in medical, it gives you more power to say, we got some of the basics, like how is this going to work? Things like vendor connectivity, networks, pricing, some of the actual intake of claims. Those things get to be bread and butter after a certain point. And now we get to focus on more of the exciting things about medical benefits that maybe historically other folks may not have been able to.
That's really interesting, Jake. Liya, what are one or two of the findings from your experience in rolling this out where beyond the obvious of a plan sponsor, or we can see the customer care representative can see the medical and pharmacy claim next to each other for that member that's calling in at that moment in time or has a question, beyond putting things next to each other in the system, what are one or two things that you've been able to take from the experience of building out pharmacy claim adjudication and apply to the medical side that are helpful in taking care of plan members or processing things more efficiently?
It's a great point. So Jake alluded earlier to the creative plan designs that we've seen on the pharmacy side, all the different complexities that go into getting those claims to adjudicate properly. We, in building out medical, benefited so much from that experience because a lot of people who come into claims administration, maybe with a different background, they don't know yet that it's possible to have one deductible or maybe two deductibles or maybe 10 deductibles on any given plan. And those deductibles can have all kinds of fascinating interactions with each other. But we already knew that. And again, other folks who come into this kind of from scratch might imagine, hey, it's normal to have an in-network benefit and an out-of-network benefit, but that's pretty much it. But we already knew that wasn't true. We already knew that it's possible to have tiers on tiers on tiers of networks. Some might be preferred for this, some might be preferred for that. And understanding that complexity helped us build a system that is going to be flexible and is going to support any kind of plan design that plan sponsors may want to enable without locking ourselves into any kind of weird corners and then having to work out of them later, which a lot of folks who unfortunately have come to this without that kind of background do have to traverse. The other unusual thing coming into the medical space was realizing how much of it still runs on human beings. So in pharmacy, right, as Jake's explained, we have to get that claim adjudicated in milliseconds and it has to be back at the pharmacy almost immediately. And there's no way for a human being to insert themselves into that timeline. In medical, it's very normal and actually very intentional to have human beings manually adjudicating certain medical claims by hand. So not the computer, not the system. A human being is going in and making some decisions. And there's great reasons for that. And there's also, frankly, some not great reasons for that. But I think coming from pharmacy, where we understand that the world can look like something with 100% automation, has been, I think, a helpful pressure to make sure that the way we're building out our platform is going to get us there, right? Or is at least going to let people control which claims require that manual review and which don't in a really fine-tuned way. And to make sure that the system is not what's preventing claims from adjudicating.
I think it's a really good example. I also find that interesting too, because obviously we have a lot of context across the product team, Liya, and we know about pharmacy and medical, but there are so many other teams as well that I think probably have a similar finding, right? I'm thinking about PA, how so much of PA workflows historically have been manual, and over the last, 5 to 10 years, really, especially over the last few years with some of the AI stuff too, has really become a lot more automated. And there's that decision, I think, that mimics medical in the same way to try and find what is the balance between automation and the balance between manual review when necessary. And I think Judy as a whole, irrespective of just claims processing for pharmacy medical, I think you really underpin just the core of Judy, that we take that approach first, right? We take the approach of finding the right balance, doing what's necessary when necessary, but also trying to build a sustainable, scalable platform that we're setting ourselves up for success and doing things sometimes against the grain of what maybe the norm is in order to do that. And I think that medical example is a perfect display of that.
So one thing that comes up often is the gap, the delay. It's like pharmacy claims real time, medical claims, I've heard 60, 90 longer days to see those flow through the system. What have we learned from that? Is there a need or is there a possibility of materially closing that gap? What have you seen so far with Judy Health, with our population? And then what are the implications of that for the future?
So I will say, you're right. In medical, there are so many different leaps that claim has to make in order to get its way to us. You go to your doctor, your visit gets documented in the EMR, then it has to flow through to their billing system, then it has to flow through to a clearinghouse, then possibly to a network, then finally to your TPA who processes it. And we don't have very much control or visibility into all of those upstream processes from where we stand at Judy Health right now. So we can't make real-time claims processing in medical happen all on our own. And that is a dream that a lot of people would love to see occur for a variety of reasons. But I think what we've learned through pharmacy is that that future is possible if you construct your systems, if you construct your contracts appropriately to support it, you can get there. And pharmacy is already living that future. So yeah, you have to get a lot of parties aligned. You have to get a lot of things figured out before that can be made possible. But I think coming from pharmacy, we have seen the future and the future is bright. So we believe and we want to see that brought to medical because it really does make everything so much easier. The kind of price transparency that we talk about in pharmacy that's possible in pharmacy is really just not currently possible in medical with the way things work. Real-time claim processing would help with that immensely.
It's funny, Susanna Villegas-Spillman talked about this our last episode, where making decisions is harder for the plan sponsor in her seat because she's, and her peers, everybody, you're looking at data that's 3 months old, 4 months old, 5 months old, 6 months old, and it's siloed. So, pulling all that together should help with several different aspects of the equation here. Another question that just came up relates to clinical processes. I'm curious if we've seen any examples where having everything adjudicated in one system helps with the coordination of care, because that's a big thing that comes up a lot. How would members benefit from this?
Yeah, I can go ahead and take this from a pharmacy standpoint. And then if you want to build off of it, Leah, I think for medical, so you're exactly right. Like, I think the nice thing about pharmacy claims processing being real time is that our clinical teams that build support some of those more complex clinical programs that we offer in Judy happen just in that moment. A member at point of sale is getting alerted to patient safety or opioid edits, or if there are other clinical drug utilization reviews that need to be done. Those things happen kind of simultaneously with claims processing and are able to be built and configured directly within Judy for pharmacy benefits. I can imagine that there are similar processes for medical. And I think the other thing to note there as well, for pharmacy, that often means, specific to some of our programs like low cost alternatives, that we do have interconnectivity with Judy's member portal and member app and are able to pass things not only to the pharmacist, but kind of secondarily relay that message to members directly. And especially now with Judy Care and the expansion of some of our member experience tools, we're really starting to see the full picture of maybe what a clinical experience would look like for a member. And I can only imagine that medical adds on to that nicely and is a nice counterpart to the other data inputs we have from pharmacy adjudication.
Yeah, Jake touched earlier, right, on the idea of the balance between automation and manual workflows. And particularly, I'll say in pharmacy, prior authorization space, we're often needing some sort of clinical documentation in order to better make a decision as to the appropriate coverage of a particular drug. Medical claims data is a much richer source of that kind of clinical information than pharmacy is. So some immediate ways in which I'm hoping that we can take advantage of unified claims processing, right, is using that medical claims data to understand what diagnosis somebody might have. And then maybe knowing that immediately helps us pass them through an easier PA approval process rather than having to reach out to the clinician and ask for documentation, because we already have the documentation. We already know they saw their endocrinologist. We already know they have diabetes. It's already all there on the medical claim. So the more of that, when we talk about, again, the unified claims processing also brings us that richer unified data set that we can leverage to make all of the decisions that are currently siloed easier and quicker to make.
Okay, that's awesome. And I love the richness of this discussion and the examples and the description you're providing of how this can work. We're at the top of the hour here, so we kind of have to go right to the last question. I'll start with you, Jake. What would you say is the most astonishing thing you've seen? Can't give away any secrets. Don't want to take any risk. Keep your compliance hat on. But as we've gone through this journey to launch this, and as we look at adding vision and dental to kind of round out the picture, what's the most astonishing thing you've seen or realized or think is just worth sharing a good story on to close us out?
I think for me, the most astonishing thing has really been seeing the potential that comes with some of our member-facing tools in light of all of the now unified claims experience that we have. And we talk about also including dental and vision in there. And I get really, really excited and really jazzed about what the future is going to look like a few years from now, where we have all of these different components and different kind of pieces to the puzzle for member experience, and what types of workflows that's fueling, what type of special programs maybe we can offer for members to either lessen cost share burdens or better coordinate clinical workflows, things we've all touched on today, right? But I think really getting excited about what is coming down the pipeline that's going to be most impactful to patients, and kind of tying back to the beginning of the discussion we were having. So often people jump right into the healthcare space and think they're going to have a really large impact on members directly because they found the solution. And I think we're really putting in the man hours to come to the solution that's right in regards to how we're actually going to have an impact long term on not only our clients and plan design and lowering costs for them, but ultimately the healthcare ecosystem and a member's ultimate position at the top of that ecosystem as the most important thing that we focus on.
Leah, how about you?
Jake mentioned earlier how one of the double-edged swords of pharmacy, right, is that so much of it happens kind of behind the scenes and it's invisible to you as a patient that all of this is happening. The claim is actually getting adjudicated when you're picking up your drugs at the pharmacy. To me, that's a feature, not a bug. I want every other part of my healthcare to be that effortless, or just to work so that I don't have to feel like I'm the one coordinating all my own care, which is what pretty much every American is doing, right? We know that when it comes to medical. So the thing that really excites me, and it is going to take time, but I think that all of this experience with pharmacy has really put this wind in our sails to aim for some of these things that are big, that are going to be hard, that we can't do on our own, but they are the right thing to aim for and they are the future.
Well, it certainly seems like we have the right building blocks in place to stack everything up on top of this. So thank you both for spending the time with us in the studio today and explaining what you've been working on and what you've learned and how it's going. Hope you have a great rest of your day, and I look forward to staying in touch.
Yeah, thank you, Justin. It was great to get to chat.
Thanks, Justin. Till next time.
Thank you for listening to Astonishing Healthcare. Head over to judy.health and visit the Insights section for show notes and other relevant content. If you like this episode, be sure to subscribe so you don't miss the next one. And definitely share the link to this show with your network. Have a great rest of your day.